Elidor Company was founded in 1994 in Bucharest, Romania, by doctors Godanu and Nicolau, willing to offer an alternative to chemical synthesis products which have many side effects. These products were conceived on the basis of the Danubian Carpathian flora, which offers a great plant variety and could be found in the ancient traditions of Trachogetic civilizations. These products are oriented towards the current pathology from internal medicine, neurology, cardiology, traumatology, intensive care, and so on. Currently, our society owns a great diversity of products conceived on the basis of pharmacognosy. In order to exemplify this concept, we want to let you know Elidor, which participated in many high level international congresses. Orthogel. The product contains natural extracts of chili pepper, arnica, comfrey, green nut, Thamus communis, Dane's blood, lavender oil, menthol. Orthogel can be used by the patients who have interdictions of taking paracetamol and those with risk for using this medicine. This exceptional anti-inflammatory product is recommended for treating the fractures, dislocations, wrenches, hematomas, thrombophlebitis, muscle extensions, tendinitis, myositis, synovitis, gonarthrosis, muscular contractions, diminishing the systemic inflammatory syndrome, diminishing the respiratory virosis, diminishing feverish syndromes of various causes, or spondylitis. When it is used for long periods of time, orthogel does not have any collateral effects and does not have any other interactions with medications. Orthogel was the only one natural product represented within the International Symposium of Intensive Care and Emergency Medicine in Brussels 2016, organized by Erasmus University Hospital in collaboration with Belgium Society of Intensive Care and Emergency Medicine in front of an international committee. Part of the committee, there were three professors specialized in anesthesia and intensive care. The product was very successful and much appreciated. Orthogel won the leader position in the complex anti-inflammatory treatment for the patients with polytraumas, infectious, and arthrosis disease. Ginger and salvia, Salvia officinalis. In traumatic orthopedic pathology, spinal anesthesia represents an unusual procedure to surgically treat the patients. In many cases, after spinal anesthesia, headaches, nausea, vomiting could appear. Although these post anesthetic syndromes existed from the very beginning, up to now there was no targeted treatment. Taking into account the Ayurvedic practice, we have administered to these patients ginger and salvia tablets taken with a great quantity of liquids both by venous routes and oral route. These results were exceptional. The unpleasant effects disappeared, and the physicians from Floraska Intensive Care Hospital sent the scientific work at the World Congress of Anesthesiology in Hong Kong in 2016 and to London Euroanesthesia in 2016. These products were very much appreciated. A novel approach to treatment of hemorrhagic cerebral vascular accidents was presented in Geneva and comprises our team's experience for this type of affection. Natural medicine represents a powerful resource wrongly neglected, which currently demonstrates its exceptional therapeutical power. As specialist in traumatology, Dr. Godanu and his team would like to show that the future belongs to the courageous ones who honestly apply the Ayurvedic, Chinese, and Trachogetic medical laws.